increase the libido and lead them to risky, unprotected sex. Long-time users have been known to develop psychosis, paranoia, aggravation, hallucination, and delusions. I, folks, have seen this firsthand as a recovering meth. I understand this report says, and this report coming from both Frontline and the Center for Control and other agencies is right on report. How do we handle the problem? That's the next question. Can meth users can they recover? As a recovering addict, say, of course you can. You have the willpower and the support structure to do it. Experts one time did not agree with me. However, in Frontline's report, PBS, in 2008, experts on thought that meth addiction were hopeless, which would always relapse, to recognize that recovery is possible and take years of medication and behavior. That is something that the Ethan King Foundation Incorporated will assist with in helping those out there that have lost their way and turn to meth as a way of enhanced pleasure, increased sexual drive, and overall party behavior. Because methamphetamine changes the brain's wiring by destroying its dopamine receptors, users need almost a year to allow the receptors to regrow. Until then, addicts cannot experience pleasure without the drug, and most slip again into a deep depression that may cause them to relapse. In addition, meth addicts must relearn certain behaviors. Because meth has trained them to associate all pleasures with they need to learn to modify their thinking and expectations. Counseling helps them cope with their cravings, examine their personal issues that led to, and help them to avoid situations that may cause them to relapse. That is the most important part of recovery, avoiding the situations that may cause you to relapse. That is my opinion, that of the CDC, Frontline, or PBS. Many treatment exist that outpatient treatment is essential to recover, with some programs starting as early as the user is still using the drug. What are the impacts on the community? One might ask. Why do we really need to combat this? Is it really a problem? We're not only going to in a minute why and how it links to HIV, and we are going to tell you how it impacts you. For a community, meth brings a of property crimes, sex, theft, and identification theft. All because addicts need money for their habit. Locals have to house newly arrested meth and provide health care facilities for those meth patients who overdosed or were injured in a lab explosion. What we plan to do at the Ethan King Foundation is resources from our industry transition team and reallocate them. That, along with our affiliate methamphetamine rehabilitation centers across the country, we plan to tackle this problem. We have also did a specific line for methamphetamine addiction, those that want to receive help, called 877.meth. That is our goal. We want to kill amphetamine and take away the addiction and disaster and devastation it causes not only individuals, but families. You could ask why. That's program one. HIV and AIDS. Now that we will tackle the methamphetamine, and we will use all of our resources, we will use all of our programs, we will use all of our governments, and we will use our new number, again that number 877-DEATH. The murder meth program will be launched beginning today. Now on a report by the CDC that takes our statistics from 2000 to 2006, and then a later report 2007. The numbers in the jump in numbers from 2006 to 2007 are staggering. They're alarming and call for immediate action now. This is a program that must be launched. In the cumulative years 2002 to 2006, There were 1 million male-to-male sexual act newly diagnosed cases of HIV. Injection drug use in the same cumulative time, 170,170. Male sexual contact and injections was a total of 68,516. Let me tell you, as someone who has walked the path less chosen, these numbers, alarming as they are, my own personal estimate, are about. There is this accepted practice within the gay community, within the community that hires and that is pornographic driven community, that if I don't get tested, I'm negative. I would be willing to bet every life that these numbers would be more if the truth were told. Someone were there to get tested, if there's or a way for them to get test shame. That is to do. We plan to not only the murder meth program and the AIDS prevention and management task force. We also plan on opening 7, originally 4, 7 men's No Shame Wellness Clinics, called the No Shame Gay Men's Wellness Clinic. And based on the statistics and that we have done from the CDC, from the World Health Organization, from the DEA, from the Journal of Gay and Lesbian Social Issues, we have identified 7 needs for gay men's centers. These centers will be unlike anything that you have ever seen. They will be unique in their design. They'll have more of a community-centered feeling rather than a, notice we call them centers, because not only at a you will have mental wellness, you will have health meals, particularly those in the disease area. There will also be a coffee bar. There will also be access. There will also be music. There will also be a job center. It will be glass front and with no shame. Everything written on the glass will be no shame. We'll get to that later. In 2006, the sexual contact infection rate was 16,001. In that same year, in 2007, it rose to 2,427, a 1% increase. That is absolutely alarming. With the increased studies showing rise in the use of crystal meth, as well as the link between crystal meth infection rate of HIV, we must tackle, as of both issues, and begin search for locations, specific cities, for our No Shame Gay Men's Wellness Center. Positive note, and there is a positive note. Injection drug use, 29%, from 2006 to 2007. Male sexual contact with injection of drug use. Now one might think, well, then does that mean that crystal meth use is on? We have to accredit the bigger cities that have needle exchange programs, particularly San Francisco, and their wonderful needle exchange program. As a former addict, it did not matter who had used the needle, where it had been, or anything, if you want it bad enough. Whether you agree with needle exchange programs, they work. And the proof is in this, because there is a decline in injection drug use, newly diagnosed cases from 2006 to 2007. Actually, from 2002 through 6 to 2007, during the institution of the needle exchange. While you may not morally agree with needle exchange, while you think it is counterproductive to what we are to do, there are those people out there that do not want help and will continue to drugs intravenously, known as IDUs, or intravenous drug users. They will use any. That is only the situation, and that is something that we must at a later time. I do commend the city of San Francisco for their outstanding drug programs and attribute their efforts to them in